Good day, dear colleagues. I would like to introduce you with Nikita Degtyarev from Moscow. He's a dentist, a doctor from Moscow Medical University, and he will be showing for you today some interesting lecture about jaw relation and our functional questions. Please, doctor, could you introduce yourself?
Thank you, Mantas. As Mantas said, my name is Nikita Degtyarev. I am an oral surgeon, neurophysiologist, scientist, and today we will talk about the centric relation problems. We will review the mechanisms of how centric relation is being lost during the lifetime of the patient, and also we will take a closer look to several centric relation determination techniques, and also I will present you my approach regarding this problem. So firstly, as Mantas has asked me to introduce myself, I will tell you about my previous experience regarding this topic. As I have said, I'm a scientist and neurophysiologist, and first steps in the field of neurophysiology I was starting to make at the second year of my university, and the third course of my education. I had patented a technology for electromagnetic anesthesia. That's the technology which replaces the local anesthesia via electromagnetic impulses, and the principles that I have calculated the pattern of electromagnetic impulses that interrupt the pain signal from CNS. This is the picture of the clinical trials we were providing at the department. Later, I have invented a technology for bone growth acceleration induced by electromagnetic impulses as well. This is my second patent for such a technology, and this is the clinical application of our technology. We were applying this after the surgeries, after the orthodontic surgeries in the university hospital. Also, my scientific interest is the digital dentistry, and I'm proud to say that I'm a co-author of the book which is called «Комплексное цифровое планирование», complex digital planning in dentistry, and I was creating the navigation surgery part of this book. I've written it, and this is my background, and later you will understand why I'm providing you this information.
Could I please ask you some questions?
Of course.
Oh, thank you. You were mentioning about pain relief, blocking the pain, yes?
Yes, this is the pain relief technology.
You mean without any chemical drugs, only with electromagnetic impulses or something?
Yes, exactly. This is we were applying two electrodes in the field of the apex of the tooth, and we were reaching the full anesthesia without any needles, without any chemicals, it's an absolutely non-pharmacal method. We have received the clinical trials recognition in my university, so we have provided clinical trials with the patients who suffer from hyper sensitivity of teeth. So we were blocking the pain which caused by the air, the cold water, and we were kind of successful. So yeah, that's my first technology. That was my introduction to the field of neurophysiology in dentistry.
And what about the bone growth stimulation? It's also electromagnetic impulse related.
Yes, my scientific topic is the electromagnetic impulses and their influence to our body, to our nervous system, and behind the mask there are several electrodes which are hidden, and I apply to the skin of the patient, and the bone growth is accelerated for about 20% after the orthodontic surgeries. So yeah, we have reached this result.
Well, I hope nobody will be joking and asking if any other parts can be stimulated to grow bigger. Let's hope our students will stay very serious. So yeah. Okay, that's great.
Thank you. So a centric relation of jaws. Another brief introduction to this topic. I was asking my colleagues, dentists, do they really understand what they're doing while applying such methods like Lucia jig, Quest the programmer, TENS, and so on, and the answers were like, yes, we are going to relax the muscles, we are going to reach the muscles relaxation. However, I have noticed that there is no deep understanding in the field of neurophysiology in the area of these muscle relaxations. A lot of doctors, unfortunately, have no idea of how these muscles are being relaxed, which mechanisms are hidden in these magical words like muscle relaxation. And the next several slides, the next topic in these presentations will be dedicated to scientific background according to the neurophysiology, muscles, and so on. So we will revise the first and the second courses of our university, and especially the physiology subject. So the centric relation of jaws. This is one of the definitions. There are, as you know, there are a lot of definitions of centric relation of jaws, but it's the most common. I will not read it, you probably know it, but I will point at three most important facts. Firstly, there's the maxillomandibular relationship, in which the condyles are articulate with the thinnest avascular portion of their respective discs. That's the one. The second is the position is independent of tooth contact. That's the very important, because this is the main difference between the centric occlusion. And third, it is restricted to a purely rotatory movement about the transverse horizontal axis. If we imagine the transverse horizontal axis at this slide, it will be like a dot going through the condyle. So the last statement means that if we a bit rotate the condyle, the centric relation is not being changed. That means that this statement permits us to manipulate with the height of the prosthetics, with the height of the teeth. So if we probably commit a mistake in the height part, in the height of the prosthetic of the teeth, it will be not so dramatic as we will mistake with the position of the disc or with the position of the condyles. So why this centric relation is being lost, is getting lost? As a matter of fact, there are different factors. Firstly is obviously teeth loss. The second is a trauma. The third is occlusion problems. And the fourth, I would add from myself, that's pain syndrome that can be caused by inflammatory process and so on. We will talk about these problems later, and we will talk about the mechanisms which are at the basement of the problems a bit later. But yeah,
sorry, doctor.
Of course.
To which of these parts you would relate the centric loss, for example, after orthognatical surgery?
If we have the periodontal receptors from the teeth, that means that periodontal part is okay. So we do not include this part. So if there will be a problem according to non-proper position of condyles, it can be seen like a trauma. But if we change the occlusion proportion and we change the occlusion by our orthognathic surgery, our periodontal receptors receive receive a bad signal, a bad pattern, chewing pattern to the central nervous system, and that's why we can call it an occlusal problems, because the right patterns, right chewing patterns by the teeth contact are written inside our brain. So that's it. And as I have mentioned it in the answer, the central nervous system controls the masticatory muscles. I hope this statement will not be seen to be proved, because it's kind of obvious that our nervous system, our brain, controls the muscles not only in the jaw but also the whole body. And let's revise what means the conditional reflex. Conditional reflex is the learned reflex-like reaction to a stimulus that does not normally trigger that response. Now let's forget about the jaws, about the muscles, and let's talk about our normal activity. For instance, if we touch the hot item by our hand, we immediately pull our hand back. The next time when we want to touch the hot item, we remember that it was hot, and our position of hand will be changed in such a way that we will be more, we will pay more attention to this hot item. The next variant is when we imagine the dog which has damaged its leg. The dog will be hiding its leg from the load. The damaged leg will not be taken apart in the walking or in the running. So the dog will keep the damaged leg safe. It's the conditional reflex. It happened because some stimulus had been applied to the leg or jaw or muscle or whatever, and our central nervous system recalculate the pattern, the needed pattern, and our central nervous system provides an adaptation to our conditions. So the force changed in occlusion or teeth loss or other problems caused a development of conditional reflex. So for instance, if patient lose his teeth on the left side, or it's the right side of the patient, so the chewing will be provided at the left side when the teeth are saved and teeth are represented, and therefore our brain recalculate the whole chewing pattern according to this current situation, and therefore the centric relation in this way will be lost, because the brain provides an adaptation according to the current situation in oral cavity in the whole organism.
Doctor, sorry.
Of course.
Nikita, could you please just a short note? Does some heavy, I don't know how to say, psychiatric or psychic diseases, disorders may have influence which would refer the shoulder herself to the chewing apparatus controlled by the brain.
Yeah,
Is it possible?
of course, and this is the next slide.
Oh, okay, sorry.
Yes,
Okay,
this is the
continue.
next slide. Yeah, so Mantas is following my predicting my presentation, the log of my presentation. That's really cool.
So it's possible that idiots are, some people with some limitations may have experience. Okay.
Of course. This is the short scheme. This is not the whole scheme, but this is the short scheme of the chewing pattern. This is the representation of the slice of our brain. I would like to say, and I will not explain all this scheme because it's kind of complicated, but I will just point at several very important parts of it. Firstly, mastication. That's the organ, this is the masticatory muscles, and this is the muscle which are providing chewing, and this is the muscles which are providing the keeping of the position of the mandible as well. And they receive the information, the central nervous system receive the information from sensory receptor that can be a muscle spindle, that's very important in cois the programming, and periodontal membrane. So the teeth are main information senders and information providers to our nervous system. This information goes to thalamus and motor area, and as Mantas had asked about it, there is also taken part hypothalamus and amygdala. This is the parts of the brain which are commonly being involved in some kinds of psychiatric diseases, and the patient with psychiatric diseases have
Simple, no?
Yeah, they have a severe interruptions of the cycle, and they show the hypotonicity of the jaw muscles. And the problem in these cases is not the muscles and are not the jaws or teeth themselves. The problem is here, and if we talk about the psychiatry diseases, the problems, our problems like dental problem is just a sign of the main disease. Also, I would like to say that amygdala take a part in pain reception and pain memory, and pain events like inflammatory processes are being kept here, and also may bring about the changes in the whole masticatory cycle. So this is another short scheme of how it's being controlled with the reticular formation, trigeminal brainstem, and so on.
So it's unconscious control, yes?
Yeah, it's absolutely unconscious control. Of course, we can position our mandible or our muscles consciously, but if we talk about the centric relation, it happens unconsciously. So of course,
these are controlled by motoric centers in a head brain or in a spine in the back. It's only brain.
Yeah, it's a really good question. The motor cortex is located in our cortex. It's a brain, but also there is a trigeminal motor nucleus. It's cannot be called the brain, or it's the cortex, and they are collaborating between each other. Whoa, and okay. That's why they're producing a proper position. And this was a short review of centric relation, and central nervous system. And now let's talk about the muscles, the most interesting part, because the function of the muscles is different, and the tissues of muscles, type of muscles are different as well, despite of the having one branch of the muscle. There are different muscles, and in general, we can divide a muscle into two types. Type 1 is the slow, and type 2 is fast. The type 1 slow is most interesting for us, for dentists because it keeps the position. While I'm standing here, my leg muscles, my spine muscles are being working. So if I raise my arm like this, the deltoid muscle is working as well, the type 1. If I'm doing the exercises like this, my deltoid muscle type 2 is being involved right now. But as I have said, the type 1 muscle for us dentists is the most interesting because it keeps the position of mandible, and it keeps the position of condyles in the C-area. And now let's connect all the knowledge we have received. So the central nervous system receives a relevant information from periodontal receptors or proprioceptors in muscles and develops a new conditional reflex of jaw position, which leads to a change in the position of joint condyles. And let's quickly return to this situation. So if there will be no periodontal information, no information from periodontal receptors, our brain recalculates the muscles pattern, and the type 1 muscle of lateral pterygoid muscle, temporal muscle, masticatory muscle are being changed in such a way that the patient will lose his centric relation according to this current situation. So our brain recalculate the whole system and changes the work of type 1 muscles, which, as I've said earlier, keep the position. So, therefore, our goal is to separate the central nervous system to the from the muscles, so that the starting position of the jaw is being reached. As we have said, the centric relation is the default position of the mandible, which we were born with. And all the existing solutions in the field of prosthetic dentistry are about to as a matter of fact, are about to stop signaling from central nervous system to the muscles. And nowadays, most of the methods for determining central relation aim to achieve the fatigue in the masticatory muscles. So TENS, Lucia G, Cois the programmer, provoke muscles to be tired, and that's the fatigue of the muscles. That's called the fatigue of the muscles. It's being reached that intracellular calcium removed from the alpha motor neuron, and there is a lower probability from signals from central nervous system to the muscle to the type 1 muscles.
Doctor?
Of course.
For example, here locally in Lithuania, it's pretty popular. It was to use some tissues or aqualizer, these with water, with these like splints with the water to amortizate the bite, the both posterior teeth. No, so it's based also on the same on the fatigue of the muscles. Yeah,
it's absolutely, because our goal is to provoke the fatigue of the muscles, and muscles are being tired. So that's the simple example. If we work in the gym and we do push-ups or sit-ups with barbell, where we have a barbell, we notice that after our exercises we're walking like I don't know, outlanders or so on. Our legs do not keep our position, because the type 1 muscles in our leg after our exercises are being tired and the fatigue is being reached. However, it's called the relaxation of the muscles. Okay, so the fatigue means the relaxation of the muscles, and when we remember the fact I have started these presentations, so the answers of my colleagues should be that they apply different methods for centric relation determination in order to let the muscles get tired, in order to evacuate the intracellular calcium from the membrane, in order to prevent the signaling from alpha motor neuron, and to reach the muscle fatigue. So the tense, lysergic, or of course leaf gauge, cause the programmer, provoke the fatigue of masticatory muscles. This leads to type 1 muscle inhibition, and as a result there is no signal from CNS. So if the signal from CNS is not being applied, therefore there is no more this recalculated pattern, and if if the jaw of the patient would have a centric relation like this, and it's being controlled by our brain, by these methods, as there is no more signal from CNS, it becomes in the default centric relation position, which we're trying to achieve, and this is our goal. So the centric relation is default position without a signal from the CNS. So, however, these methods it's not my only opinion, it's the opinion of the doctors from different countries and universities, that as we all have the unique anatomy, as we all have different sizes and different stories of our centric relation loss, you cannot determine the exact time to cause the fatigue of masticatory muscles. For example, in some cases we need to apply TENS for 20 minutes, or in some cases for 40 minutes, or in some cases we should prescribe the programmer for 2 weeks. For example, for some patients, leaf gauge exercises for 10 minutes are okay, in some cases 30 are not enough.
But what is your opinion? What is your opinion about the kinesiotherapist? Visiting kinesiotherapist for a few months to releasing the tensions in the face muscles to prepare the patient for the programming of the muscles. Does it have, in your opinion, in your research opinion, does it have a positive effect?
My opinion is quite complicated, yes and no, because kinesiotherapists, as I know, work with the muscles. Their goal is to relax the muscles and release the tension from the muscles. However, I understand, and we have it proved, that the reason is not the muscle, the reason is the centric nervous system, and we have to find the reason why it was so. If the kinesiotherapist release the tension of the muscles, and the reason is a muscle, that's okay, but the temporary treatment is also a treatment. When patients feel themselves better, that's okay. But as I see, in 90% of cases, the reason is not the muscle. The reason is kind of deeper inside our brain, and we have to look about other illnesses and other diseases that cannot be caused only by CNS problems, but they just can lead through the CNS. So that's it. Yeah, as I have said, you cannot determine the exact time to cause the fatigue of the masticatory muscles, because despite of we have the structural anatomy is about the same in most of the cases. However, we are unique, and the parameters of muscles and centric nervous system is unique too. So this is our solution, the Temanik device, and it will be a health-shaped device which is placed on the head of the patient, and the electrodes will be in the area of temporal-mandibular joint. Here will be a position for camera to capture the actual position of the maxilla and mandible during our manipulations. There will be changeable models for liner, for electronic liner, and my idea is not only to create the device which controls remotely, but also my idea is to create a helmet device shaped in order to integrate this device into a digital dentistry protocol.
What do you mean the camera to capture the position?
The idea of the camera is I'm inspired by some axiography apparatus. So the principles of the positioning of the mandible and mandible position capture will be taken from the camera-based axiographs and axiography devices. But that's the future, and now this is the default device for jaw relation determination. The most important parts are the electrodes and the remote control, like this. And also I would like to mention that Temanik device is capable of reaching the centric relation determination position within 60 seconds, and it's kind of the fastest way to do it nowadays. And why it is so? In order to achieve immediate inactivation type 1 muscle fibers, which we were talking about in the previous slides, we should remember that the physiology of the reverse myotatic reflex. The reverse myotatic reflex is the unconscious instant reflex in order to prevent the traumas in our body. This is I will show you a short example of it. If I raise my hand like this, there is no tension at the hand right now, and my muscles, my type 1 muscle are activated right now. And here is on the wrist there are ligaments, and in those ligaments there are Golgi receptors, and if I press my ligament, my hand gets weaker, and my hand changes the position of it. So this is the example of how reverse myotatic reflex functions. This is the very instant mechanisms and unconscious reflex. So with this device, with this Temanik device, I activate these Golgi receptors not in the wrist but in the jaw, because the receptors and the principles of their work is the same. So the ligaments contain the Golgi receptors as I have said, the activation of which causes a reverse myotatic reflex, a temporary separation of the type 1 muscles from the central nervous system, and thus a muscle inhibition. It happens immediately. There are, as we see now, there are different ways of how to stop the signals from central nervous system to the muscles. The first one is the fatigue. We have to reach the fatigue of the muscles by existing solutions, or we can apply a reverse myotatic reflex and Golgi receptors in order to inhibit this within seconds. This is the examples of how of the action potentials pattern from Golgi receptors. Action potentials is the quants of information themselves that are being sent to central nervous system. If we take a closer look to this picture, we see that Golgi receptors are nerves themselves, and they are integrated in the collagen fibers. And when the muscle is being stretched, the collagen fibers are touching the nerves, and this Golgi tendon organ, which means nerves, send the action potentials pattern to the centric nervous system, central nervous system. And I have taken a Hogkin-Huxley model. This is the mathematical equations which for which Hodgkin and Huxley have received a Nobel Prize in 1953, as I remember it, sure. And I have calculated the needed pattern for Golgi receptors, for activation of Golgi receptors to reach this kind of pattern by electric impulses. And since the Golgi receptor is the nerve endings bound between collagen fibers, we used the Hodgkin-Huxley model, as I have said, and we have revealed that necessary frequency of our electric impulses is 2 kilohertz or 2000 hertz, since with the current is unit uninterrupted generation of action potential by Golgi receptors is achieved. Yes, as this statement shows that it's very important that there have to be no pauses between the action potentials in the Golgi receptors pattern. That's very important in order to activate the reverse myostatic reflex. So the electrodes are located in temporal-mandibular joint area. Right now it's like here, and we are planning to create this device. It's not so hard to do, because the electrodes will be gel-like electrodes, connected with the skin and just pressed with a helmet, and the boring part of our presentation is over, because this is was the scientific theory of my
it's too cool for us, for dental technicians. Not many of us. I was watching and I was thinking, if you're lying for me, showing some black magic, or because
no, it's not magic. It's only the mathematics and not more. So now let's talk about.
I hope that headset has some cool RGB lighting, you know, for patients to impress them. Oh,
LED lighting and so on.
Going to Matrix.
Yeah. Now let's see which structures are influenced by our electromagnetic impulses, and of course that's the ligaments of the joint.
Oh, sorry, please, can I interrupt you? Just ask one small question, which in some rare cases may have a big importance. Have you tested what about the voltage and the interference of this device with heart stimulators? No problem?
No, it's a problem. We have never tested, but it's forbidden. It's forbidden with a heart stimulator. All the electronic devices with a heart stimulator are unfortunately forbidden. It's not our rule. It's the worldwide rule, and the 10 devices.
Okay, thanks.
Sorry. Yes, and the ligaments of the joint firstly are being affected by our device, and as I have said, there are the Golgi receptors and the ligaments. And the most terrifying question, what we are going to deal with the lateral pterygoid muscles. Yes, it's being inhibited by the ligaments which are being connected with the anterior part of the disc. So the ligaments of lateral pterygoid muscles are connected with the disc, and our electric impulses, if we imagine that electrode is located in front of the ear, the electric impulses goes through the ligaments and performs the inhibition of lateral pterygoid muscles. In this case, the temporal muscles, which is shown on the next slide, but never mind, the masticatory muscle, temporal muscle, lateral pterygoid muscle, and other associated muscles with temporomandibular joint receive the information send the information to the brain that Golgi receptors are firing. We have to stop any activity. This was done by the electric impulses because we activate the reverse myostatic reflex, this one. So we are like pretending, by our electric impulses, we are pretending that our muscles are overstretched and our brain sends no signal to the muscles. However, the muscle, we can clinically we can see the slight contractions of the muscles, but it's being caused by outer impulses from the device. The temporal device is being activated, the temporal and masticatory muscles. But the most important fact that we have removed the signal from CNS, and the muscles are being slightly contracted by the outer generator, our device. Our device controls the muscles, and as our impulses of the device quite equal, not quite, they're totally equal, we have no misconceptions like our brain do. And clinically, when we apply our device, we see that temporal and masticatory muscles are being slightly contracting. So also the facial muscles are also being involved, and we clinically we see the slight shaking of the surrounding muscles, eye muscles, which is the sign that our electric impulses have already reached their goal, and the centric relation is being found.
Can we be determined just by looking to the patient that the procedure has been successful, or should we give some questions, ask for patient sensations? What kind of sensations patient is feeling? Maybe he's feeling pain, I don't know.
No, it's not a pain, it's a very strange sensation, because the electric, when I ask my patient to describe the sensations, I hear a lot of versions with somebody tells that it's a buzzing, somebody tells that it is squeezing, but there is no pain, and clinically as doctor you see the slight movement of this facial muscle, the slight movement, the slight shaking. There is no pain. I will show you a video later of the clinical application of our device, and you will notice of how it's being looked on the in the real life. So
it's not like we are losing their control of themselves, and I don't know, something bad can happen.
No, the device is programmed, and everything is under control. And also there are devices like TENS device on the market, and believe me, the sensations from TENS device are much worse but it's only my opinion. It's my opinion only. Maybe some doctors will prefer TENS device, I don't know. So in the end, we have that. We affect the ligaments, there is no signal from CNS, we turn on by outer generator slight contractions of the masticatory muscles and our parameters of electric current are equal. There are no misconceptions like in our brain, and the facial muscles are reacting and evolving as well. So the highlights, it takes 60 to 120 seconds to find centric relation. The Golgi receptors deactivate the action of the central nervous system on the muscles, and there is no need to predict whether we have reached or not, how much time should we spend for it. No, it was in the previous versions of centric relation determination methods. We don't have such a problem. The activation of masticatory muscles, asymmetric contractions of masticatory muscles give an approximate height of lower part of the face. Centric nervous system still has no influence on muscles. That's very important. And activation of the facial muscles, a slight tremor of the facial muscles is a sign that impulses have reached their goal and centric relation is being successfully found. This is my first part of clinical trials, because the theory is okay, but we had to prove it clinically, and this is the axiography methods. We were comparing different methods by axiography, and we were inviting our patient in different days in order to prevent the mixture between influence of several centric relation methods determination. And this is the CT and computational tomography, and we were dividing the lower jaw, and here are the points, the 3 points of our axiography, and we were seeing how they are positioning, how our device position the condyles according to the slope, the temporal slope. So this is the 3D panorama. I don't know if it's seen on the camera, but anyway, there are three points at this 3D panorama, and the green point is Temanik device, and we see that Temanik device, our device, shows the tendency to superior and anterior position of condyles, which is clinically proven and clinically more preferable for us as dentists. So this is the video of the clinical application of Temanik device. This is a dentulous patient. I have made wax bases, 2 wax bases for such purposes. And yes, here I'm placing the wax bases. You can see it in the mouth. So firstly we have found the height of the lower part of the face. Then I made an incisions of the wax bases, and after that I have placed these wax bases and turned on my device to, and when the height is found, by my device I have found the position of the mandible, and then with bite silicone I have registered it. So
Could you please tell us how you made the axiography? Because it is a dentulous patient, so you were doing axiography without any teeth or dentures, or you put something, I don't know, position in the wax?
Yeah, it's probably my misconception. The axiography was the word teeth, if you see. So the right. So
this is the case, yes.
Yes, there are. We have tested. I don't know how many, but many patients, and this is not the patient I show. So this is the previous patient.
For example, would you recommend using axiography with Temanik?
Just to prove, why not?
And for just the 4 big restoration cases?
Yeah, it can be applicable, and the optical axiography is kind of a good solution in this case, but we have to know that we register only the position of condyles. So in order to create the full understanding of how we're being processing with patient, we have to make a CT for patient, we have to divide the lower jaw, we have to make an axiography, we have to receive these dots in the 3D panorama, and after that we will have a chance to evaluate the exact position of the condyles according to we will just have an opportunity to virtually move the mandible and to evaluate. But this is another patient, and
yes.
This is the
and for axiography, would you recommend for example for your concept, would you recommend first of all maybe registering a centric relation with Temanik, and maybe only afterwards going, I don't know, preparing some sort of teeth setup and then making axiography, or it's not relevant? What is your position? Does teeth are the teeth relevant for registering axiography?
Yes, if now let's go step by step.
Okay.
Actually, my method, my technology do not assume any axiography. We were just testing, because when we have created a theory, we had to know whether it's workable or not. So because it's kind of risky just to without any test just to treat patients with total prosthetics, and we were trying to understand where it's positioning the mandible. When we received the positive results, and also we were applying not only axiography, we were providing MRI, we were providing CT, and we have seen, we made a bite registration for each patient which were treated by Temanik, and before we start the procedure with this bite register, they have been done the CT and MRI, and röntgenologists have described what they have seen and where the condyles are located in every case of Temanik. So my opinion to the axiography is that if we have teeth or implant-based prosthetics which has the retention, the hard retention, we can place if we talk about the camera-based axiography, we can place the special device which is being captured with a camera, and of course it's relevant. If we talk about a dentures patient, and if we make, for example, wax bases, these wax bases do not have a hard retention like teeth or implant-based prosthetics, and therefore it can be pointless in some cases. But that's depends on the goal which we are trying to reach, because axiography can show the position and actual position of the mandible and the tracking. So it depends on the situation.
Thank you very much.
So let's proceed. This is how our yeah, I'm checking whether the box bases are okay, and my impulses are being working, and I don't know if camera catches, but clinically it catches actually the slight tremor of the facial muscles is being seen, so the patient sees without any he reacts to this normally, despite he is making it the first time in his life. So yeah, Actually, we set our generator to being pulsed to increase the pulses within 60 seconds, and with these 60 seconds the jaw, the electric current is getting reached to Golgi receptors. So right now I'm checking the position of the wax bases, and I register the actual position of wax bases with a bite silicone, with a hard silicone, and my device is being working. So the average time of the procedure with a centric relation registration took about 2 minutes, and the other 2 minutes is just to wait, because in order to let the silicone become hard. So it's quite fast, and we can apply it in edentulous patient, and the easiest way with a patient who have teeth. And this is the clinical evaluation of the prosthetics, which were got by Temanik device centric relation determination. So the patient is happy, and other
pretty nice dentures.
Yeah, pretty nice dentures, the high aesthetics, and from my point of view, the position of condylosis is also good. And this is a very interesting case in the field of Temanik and in the field of centric relation, because my colleagues had asked me to view the patient who has suffered from some kinds of pain syndrome in the right gum area. So the complaints were sudden occasions of the pain on the left ear, abnormal skin and gums receptions, feeling that soft tissues are increased in the size on the left part of the face, and discomfort in the temporomandibular joint, clicks and crunching during the mastications. So I've asked the patient to make an MRI, and we have revealed with the rentgenologist that disc is kind of squeezed, and the capsule become wider, and it provides the pressure to the facial nerve. And my tactic was to create a mouth guard without coist deprogrammer. The mouth guard based on the centric relation, because there was no disc dislocation, no frontal or no posterior disc dislocation. It was just squeezed. So we have find the centric relation by Temanik device, and this is the initial evaluation, and you see the deviation of the mandible. So the centric relation was determined by Temanik device. 2 electrodes within 80 seconds. Here was registered by silicone, and models inserted were scanned. So I have scanned the models in the centric relation position in Exocat. They were found like this, and bite splint based on found relation positions was modeled and prescribed to the patient. So also several words about the mouth guard. I have done it in the centric relation, and I've also remodulated the protrusion and lateral protrusion contact, because they're also very important. So this is the photo of the mouth guard, and after 2 weeks of permanent wearing, the patient had no more complaints. Absolutely no more complaints to the pain, no more complaints to the cracking, and so on. And I've asked her to provide evaluation, and you see that the deviation is 90% disappeared, and this is the result only within 2 weeks of the permanent guard wearing. So this is where my lecture, my introduction. Thank you for your attention, and of course I will happy to answer your questions, and thank you, Mantas, for inviting me and for presentation, and thank you all.
Thank you very much. Thanks a lot. How could your colleagues, prosthodontists, surgeons, maybe orthodontists, or even the dental technicians and other colleagues, how they can reach you, send you the question? Maybe they don't want to post any comments or questions on the YouTube or Facebook. Maybe we would like to contact you directly.
I can show you the slides of my contacts.
Please, it would be great if you.
Yeah, of course. Of course.
Простите, доктор, а может у вас напрямую на русском тоже? Нет, потому что не
да,
все
конечно, можно на русском. Мы сказали литовской, we speak English, мы говорим по-русски, und wir sprechen Deutsch.
Auch Deutsch können Sie, wa?
Ja, ich kann Deutsch sprechen und
super geil.
Ohne Probleme. Danke.
Okay, so and as I understand, you are now also present in Lithuania. So you are spending a lot of time now in Lithuania. Yes, you have also opened a company.
Yes, I have. This is my another presentation, but nevertheless, my colleagues, and here are my contacts. Yeah, I found the OAB Temanik in Lithuania. I'm relocated to Lithuania. I'm right now in a permanent location in Lithuania. So
just wait a second, guys. I will show it to you from a closer, and I'll put a nice screenshot later. Please, here you go, the contacts.
Yeah.
And you will see the screen on the video with the detailed contacts, so you can reach out Nikita Degtyarev.
Yeah, exactly.
Okay, at last I learned how to say it pretty much. Okay. And I also would like to give another question, which I think you will get. Have you got any samples, any demo units of your equipment in European Union somewhere, maybe in your office in Lithuania?
I'm trying to transfer these units, and I hope I will take them, but now by the current time I'm developing with the local partners the helmet-like device, because I have understood that we have to develop this device which can be used not only by me, because I have constructed this device with the wires and so on, but by other doctors with the remote control system and so on, in helmet-like shape. And now I'm currently working on it, and I will doing within this year exactly. But of course I have an opportunity to bring all of my electronics, the raw electronics, unfortunately, from Moscow to Lithuania, and to perform this device and this technology as well.
So have you got any working units with you in Moscow or in Lithuania?
I have the working units only in Moscow, and I will send them here because there can be some questions on the border, because all of the items are being viewed, and
yes,
the electric plate or the electric PCB plate that is not certified can cause some questions on the border, but we will do it, I hope, with a post delivery service. It's not a problem.
Okay, then so can the colleagues post you some questions under the video on Facebook?
Yeah, of course, the colleagues, if we would like to open the like an open discussion, you may leave your comments on under this video. If you would like to contact me directly, here are my contacts. and no problem. I'm a very open-minded person, and I will answer all the questions above and under the video.
That's amazing. I don't know how about you colleagues, but for me it was very interesting lecture, and hopefully, I don't know, maybe in the future Nikita will find a chance and time to tell something about his work with guided surgery.
Yeah, of course, yeah. That's my another scientific theme. Not only scientific, that's a practical thing, because I have a team of specialists. We are working on surgical guides and various of navigation surgery kits like Real Guide, Alpha Bio, Nobel, BTK, Renova, and so on.
We are here at the Straumann land.
Yeah, Straumann. My first implant was Straumann. That's therefore no problem. So
no.
Yeah.
No, it's okay. We've also got a lot of that. So thank you very much. Thanks a lot. And let's see if there will be any questions.
Yeah. Let's see.
Hope to see you next time. All the best luck for you.
Thank you. You too.